Okay, let's move on to Medicaid. And Senator Krist, this question is for you. A proposal to expand Medicaid to about 90,000 low-income Nebraskans is going to be on the November ballot. You've said you support the measure, which would increase the Medicaid cost by about $64 million a year when fully implemented. Where would you find that money?
Well, first of all, I've been involved with Medicaid expansion and this dialogue for the whole 10 years I've been in the legislature. The prime point here is that over 30 states have already implemented some form of Medicaid expansion. Using a judicious use of our waiver process, we can find the kind of support that we need for 90,000 people who are uninsured. 35,000 of those are my fellow veterans. It is not going to cost the state that much money, and it needs to be done. I supported the petition, and I will vote for it, and I will help enable it as governor.
All right, Governor Ricketts, a similar question. You've said you do not support the measure when it comes to Medicaid expansion. How would you propose to provide health care coverage to those 90,000 people, most of whom currently work?
Well, the real problem here with regard to health care coverage is that Obamacare was a failure. You know, President Obama told us we'd be able to keep our doctors, that our premiums wouldn't go up, and none of that actually turned out to be true. Our premiums have gone up. Our deductibles have gone up. And as I travel around the state and talk to people, this is a huge issue, especially for small businesses who are trying to provide those benefits to their folks. The solution has to be that the federal government needs to take this on and in the Congress and working with the president, get real health care reform, something that would make it affordable so people could actually buy it. One of my concerns with Medicaid expansion, and Craig, I actually disagree with you a little bit, I think that by the time it gets fully phased in, it's about $100 million to the state. And what that means is that's going to be the program itself will be moved away from the elderly and disabled and children that it's actually supposed to be focused on. And the states that have done it have gone vastly over their budgets. And that means that here in our state, it's going to take away money from education, higher education, property tax relief, and roads.
The governor's made an absolute statement about states that have funded it, and it's not true. Many states have not gone over their budget. Google it, fact check it. It is true.